Welcome to this discussion entitled Contribution in a Crisis, NYUAD's COVID-19 Response. I'm Mina Al-Arabi, Editor-in-Chief of The National, and I'm delighted to be having this discussion with a great panel. Our discussion comes today as part of the marking of a momentous moment for NYUAD as it celebrates its 10-year anniversary. 10 years of innovation, community building, developing solutions, and preparing for the future. Now, this anniversary comes at a moment where all those elements are at play as we continue to live through the COVID-19 pandemic and adjusting to what that pandemic brings with it. It has been difficult for many, and it has also brought about a need to contribute across all sectors, but particularly from places of excellence, centers of excellence, and research centers, places like NYUAD. So Abu Dhabi had a 360-degree reaction and response to COVID-19 and ensured that people were both kept safe, healthy, but also were able to prepare for what comes next. And NYUAD had an important contribution to that through community support programs, research across the board on masks and treatments and beyond, in addition to measuring societal and economic impact of what was to happen. To discuss this issue and many other elements of the time we're living through and how a crisis response was developed at NYUAD, we have with us Dr. Farida Al-Husani, who's the official spokesperson for the health sector in the UAE, Dr. Ayaz Virji, who's the medical director of NYUAD Health Center, and Teodora Hritsovska, who's a former NYUAD student and student government president. Welcome to all of you, and thank you for joining us. Dr. Farida, I'd like to start with you about how Abu Dhabi responded to the COVID-19 crisis. Many of us remember you and recognize you in those early days of the pandemic where you were the face of reassurance for us. You would update us. Those of us who lived in the UAE really would wait to see you and hear from you. But that response and that transparency was part of keeping people feeling as safe as possible, but also informing them of what would come next. So I want to ask you about that response, but also how an institution like NYUAD was involved and was able to make a difference, both through research and community support. Dr. Farida, over to you.
Thank you, Mina. I'm really glad to be today with you and with the great panel that we have and to share some of my experience related to COVID. Actually, we are really blessed to be living in Abu Dhabi and in United Arab Emirates during the pandemic. And you could see that Abu Dhabi has been ranked the safest city in the world when it comes to living and the quality of life during the pandemic. And this is not something that was achieved out of sudden. This is really a result of a wise leadership and a clear strategy that formed our response to COVID-19 throughout the pandemic since the beginning. And I have been working with many stakeholders at the national, local level, and really NYU has been one of the active partners and stakeholders that have been closely coordinating with us from the beginning. And we have been working closely together, especially when it comes to the research and innovation part, because when you are dealing with a new emerging infection, it's really about how proactive you are and how active you are in the area of research and innovation, because you need to learn more about this virus and you need to know how to fight it and how to control it. So research is a crucial element of the response to the current pandemic, and this is one of the key success factors that we had in Abu Dhabi. So I would like to thank NYU team and the students in this university for their active engagement and active role that participated to the success story of COVID response in Abu Dhabi.
Dr. Farida, I want to pick up on what you said regarding the preparation in the early days of the pandemic. Now it feels like we all know what we're doing. But in those early days, how was NYUAD involved in that reaction? And how did you, as an official that was at the front and center of dealing to the pandemic, find that relationship fruitful?
The engagement started from early on in the beginning of the pandemic in multiple discussions. The first one of those discussions were with Dr. Ayaz Berjay, who is currently with us in this panel, talking about the safety of the students, of the academic members of the university, and how we can ensure their safety. What are the requirements that need to be started? And there has been a lot of active conversation happening regarding that, learning about other countries' experience and how best we can respond here in Abu Dhabi. And then we started to also engage when it comes to the technology and innovation for the how we can have a better testing than what is currently available. What are the challenges that we had in the diagnosis of COVID-19? In the beginning, it was very hectic process and long process for testing and for the results. But we catched up very quickly, and NYU played an active role in developing the diagnostics part. In addition, there has been many meetings and conversations regarding research and how we can improve the response in multiple dimensions. One of it is regarding the epidemiology and understanding what are the risk factors, what are the main determinants of the illness that we had. The other part of the discussion was about the vaccines safety and the effectiveness of different vaccines. And also we have been engaged when it comes to the new innovations and the new technologies that can help us in the response for COVID-19. So it has been really a very fruitful and very active engagement of the university and different scientists within NYU, helping us in the response and playing a very active role.
Thank you very much, Dr. Farida. About that relationship, but also really how you prepared as an institution in those moments and where you find yourselves today. But please, over to you.
Yeah, so thank you. And thank you, Dr. Farida, for your kind comments. I still remember our first case back in March and when I called you and how helpful you were in giving us direction on treatment modalities and management so early in the pandemic. So I would say that the institution relationship with the Department of Health and the Public Health Center has been very dynamic, and I'm very thankful of that because it's a constant ideas exchange, and we're all learning this together. And I'm particularly impressed with the commitment to research and clinical trials, working on the vaccine so early, on attenuated viral vaccine back in, I think it was July of 2020, and then a viral vector vaccine in January of this year. And I think that what we've done, what we've been able to do, what we've been able to help, hopefully, is to improve on the safety of our community and the greater community in general. And I would just add that, Time Magazine quoted Abu Dhabi as having a textbook example of how to respond to a pandemic. And I'm proud to be here and to witness that firsthand.
I love that textbook response because that's how it felt. It felt like it was thorough and across the board for those of us who were living there at a time of such uncertainty. But it must have also been difficult when you have a student buddy there and you have your first case. How did you go about, and also the faculty of NYUAD, do you go about reassuring the students primarily, but also their families at that time?
Yeah, it was very interesting because back before COVID-19 was even declared a pandemic by the WHO, February 11th, our vice chancellor called upon us, I think it was back in January, to do a tabletop exercise in case this thing spreads. And I remember thinking, why are we doing this? We haven't even established human-to-human transmission yet. But here we are with public safety, health center, environmental health and safety, faculty. We're all running through this exercise. And it turned out that was very prescient because, look where we are now. And then early in the pandemic, the senior leadership established these work streams, 6 different work streams: public health, residential education, faculty, facilities, understanding that this was going to be tough, that this was going to be complicated for a college environment, which is a communal setting. How are we going to contain this? How are we going to ensure the safety? And secondly, it was going to be all of us in this together. It was not going to be one department or another. And oftentimes in academia, you can work in silos. Faculty are kind of doing their own thing. We're doing our own thing in kind of student affairs. But here, we all have to come together. So on for example, the public health work stream, which I co-chair and is led by Fabio Piano, who is our former provost. We have, doctors, we have nurses, we've got residential education people, administrators, we've got a mathematician who helps us with modeling. We've got kind of everybody, and it's a dynamic response and relationship, just like it was way back then when we didn't quite know what to expect.
Thank you, Dr. Ayaz. I want to turn to you, Theodora, because as we discussed the institutional response, there is also, of course, the student body of NYUAD, and it is both a multicultural group of students, and many of them didn't have their families here. So it must have been quite the moment as student government president, the role that you played, to be part of that response, but also how the preparation was made to move people off campus.
Thank you, Mina. I want, just like Dr. Ayaz and Dr. Farida were speaking about the early beginnings, I'm going to start from there. Because at the time when the pandemic started, I was looking at everything that was happening in Abu Dhabi and NYU Abu Dhabi remotely, because I was at home. And looking back from this perspective a year and a half later, I genuinely can't believe how much has been done, both at the level of Abu Dhabi and the UAE and within our university. And to go back to the question about students' feeling of safety and reassurance, I can recall that beyond just health concerns, students in the early beginnings had questions about whether they'll be able to come back to university physically, whether they'll be able to continue their classes in a safe environment, because for many students, they just didn't feel, for example, safe at home, or their countries were under very high risk level. And then the other questions were about community building. So although the primary concern was, of course, health, there were many other things that were in play, like we've seen with the pandemic. And we know from all this research across disciplines that the pandemic is, although primarily health crisis, is also economic crisis and mental health crisis. And we've seen that reflected within our community. And I think that for majority of the students who've already been part of the community, so apart from the first years, for majority of the students, there was a sense of trust, given that they have been here and familiarized with how the institution works and familiarized with Abu Dhabi as a city, and just knowing that Abu Dhabi is a safe space to be in general. And likewise on campus, students already knew, even before coming to campus or having majority of the information about the testing or about the vaccination, which came later, they already knew that being on campus and being in Abu Dhabi will be the safest option for most of them. And I speak this both on behalf of the students and myself. I also knew that I would want to be in Abu Dhabi in times like this and on campus, because it would be the safest place to be. And later on, apart from that, and after receiving the information, the students were even more certain that that's the place they would like to spend while focusing primarily on their academics and academic progress. And after that, now thinking in retrospect, I think that being on campus for the student body, apart from just lowering all those health concerns and making sure that students are safe, it had a large positive psychological impact, in the sense that students were able to study while feeling safe and while not having any anxieties about whether what's going to happen to them if in worst case they have COVID, because we had all the measurements established by the public health portfolio in collaboration with the Department of Health of what's going to happen and all the testing protocols. So it really, beyond just the health and safety and beyond that collective safety that was felt, it was also on an individual level very beneficial. And I can say this for myself as well.
Thank you, Theodora. Can I ask you, what advice would you give a freshman preparing to come to NYUD at the moment? I think for many of us, we thought the pandemic would hopefully be behind us, but it's still very much here. What advice would you give them?
Thank you. That's a great question and a challenging question for me, because I know how my freshman year looked like. And just in general, that transition is difficult, and yet alone doing it in a pandemic, I can imagine what it feels like. But one thing I would say to first years right now is to have faith in what the university is doing, because if there is one thing I'm 100% certain of, is that the university will put the health of its community members beyond everything else. So no matter what happens, if they are here, they should feel very confident that they will be safe. And I'm speaking both for being on campus and being in Abu Dhabi. And the second one is just to be very mindful and conscious of their well-being and mental health, because I think that's also something that has been affected during the pandemic, and just do check-ins from time to time, and to just to do their best given the circumstances.
Thank you. Very wise words, Theodora. Thank you. Dr. Farida, I want to turn to you, because one of the things you often speak about is the importance of mental health, and is the importance of people adjusting to this, but also maintaining social contact, even if it's not in person. So how do you think that's impacted not only students at NYUAD, but the wider community? And what advice would you give?
I agree that this is a crucial element of the overall response, and the focus in communication is very crucial, because you need to keep the engagement with the students, because this will help them to, if they are sick, for example, to be recovering, if they feel any isolation, to be engaged with the community, engaged with other students, and engaged with their teachers. I think mental health the pandemic has impacted the mental health globally across the globe. And in Abu Dhabi, we have been really paying a very big focus and attention to how we can be cautious about the mental health, whether it's for the healthcare professionals, but also for our community. And we launched many initiatives to support the mental health of our community, and to keep a direct contact and a direct access to healthcare professionals if needed, but also engage with the community and try to help them to pass through this pandemic with the least impact when it comes to their mental health and mental well-being, because it's really crucial. And it's at the end, it's not only impacting the overall life quality, but also it's impacting their immunity to the disease itself. So it's really very important factor that we have been focused on it since the beginning of the pandemic.
Thank you, Dr. Farida. Dr. Ayaz, I want to turn to you and to ask you more about how the NYU Abu Dhabi Health Center adapted to deal not only with the physical, but also with the mental health issues that have come with the pandemic.
That's a great question. I'd like to thank Dr. Farida and Theodora for their responses. And just to continue on what they had said, the advice I might give to freshmen coming in, the first thing is get vaccinated. And I'm very happy to announce that as of yesterday, we can confirm that over 90% of the NYUAD students, staff, and faculty have been fully vaccinated, and the others are on their journey to vaccine. And kind of talking about the mental health aspect, we do need to have a return to normalcy to some degree. Vaccination, I actually think, is our way toward that because it becomes more of a pandemic of the unvaccinated. COVID-19 will be here, but we can get through this pandemic because we can eliminate a lot of the bad stuff that COVID-19 causes, like the strokes and the clots and the respiratory failure, and turn it into a bad cold or a flu through what modern science has been able to give us through a vaccine. So I would encourage everybody to do that. So regarding the health center's response, so early in the process, we developed a mitigation strategy where we focused on screening, testing, tracing, isolation, mental health, and now also vaccination. So these 6 key elements have been something we've been working on since the beginning. From a screening perspective, we developed an app in coordination with our flagship campus in New York that all of our members had to complete. It was kind of a COVID-19 screening app before they were allowed on campus. And the idea was to get people thinking about, okay, do you have a fever? Do you have symptoms? Because many times we don't think about that. We just kind of go to work or we go to school. But now in the middle of a pandemic, we have to, especially something that can be spread so quickly. So they had to complete this app. From a testing standpoint, we followed the guidance of the Public Health Center and the Ministry of Education. We followed it to a T. Many times we became even more strict on testing. As Dr. Farida mentioned, we developed our own microfluidic process of PCR testing. For early detection, we can detect even earlier than regular PCR if there are cases that can be transmissible. So we incorporated that into our response. Contact tracing, that's been so much of our time has been dedicated to that. I think it's the bane of all of our existence at the health center, but you got to do it. And it's gotten easier, particularly as you've narrowed the hard contact definition, and we've learned. But if there's a household contact, if there's a close contact, we even look at what's called proximate contact. So we took the contact tracing strategy and we added and we kind of customized it to a university. And then isolation and intervention, we followed the literature. I know that the Public Health Department and Department of Health has been actively involved in research. They set up this expedited internal review board for COVID research, which we very much appreciate, which helps us to get, more science and knowledge to the forefront and to understanding intervention as far as prevention, diagnostics, and therapeutics, all 3, because you need all 3 to beat this thing. And then finally, mental health. Our counselors were involved aggressively, I would say ambitiously, during things like travel quarantine, because students, they're new to the country. They're new to maybe they're freshmen, they're new to college, and now they have to be in travel quarantine for their safety and the safety of others. So making sure that we actively reached out, and we have different departments in student affairs, including the health center, including now our student leadership department and coaches that are involved. We even had athletics set up things like virtual training courses that they could do in their rooms to help get their minds off this, because they're here to study, and this is a hard thing for everybody.
That's really interesting to hear across the board how you were mapping this out, and of course your point about vaccines being crucial as the next stage to get us to normalcy. So as we think about the next stage, I want to turn back to you, Dr. Farida, please, and just in terms of research and public health, how you see it going forward, how that collaboration with NYUAD, but also on a wider front, how public health will be administered, let's say, or will become a focus post dealing with the immediate impact of COVID-19?
I think continuing the good work that we have is part of the next steps, but also building on that and enhancing the capabilities when it comes to this pandemic and being more prepared for the future as well. We were blessed to have a leadership who really had a very long-term vision, and we have been using all the current challenges as opportunities of the future. And therefore, whatever research that we start today is not only meant for the current response. It's meant to build up our capabilities to be more prepared for future pandemics. And therefore, our focus on research has been going on, and even we are expanding when it comes to research for the pandemic. The current areas of focus is really about the vaccine, because we believe that throughout history, vaccination have been the most effective strategy when it comes to the control of infectious diseases. We did not reach the optimal level at this stage, but we have really been advancing. And Abu Dhabi and United Arab Emirates played a proactive role by starting the vaccines from the clinical trial phase into the introduction of the vaccine to different age groups. Currently, we introduced the vaccine for children, and there is more and more research to come, more evaluation on how we can be better in the future and how we can develop our response further. So we are not stopping to what we achieved. We are building on our achievements for the future response.
Thank you, Dr. Farida. Dr. Ayaz, I want to turn to a subject of research and the research that NYUAD is doing, but also what the future looks like. At the moment, NYUAD has had 10 research grants directly related to COVID-19. And part of the remit of the establishment of NYUAD 10 years ago was really to become Center of Excellence when it comes to research. So I want to ask you, from the perspective of the health center, but also widely at the university, how much of the research will be related to either COVID-19 or the wider issue of public health, as Dr. Farida was referring to?
Yeah, so at NYUAD, we have 16 research centers. So it is one of our primary modalities. And as you mentioned, we have 10 grants now to work on this pandemic. First, for the current pandemic, and also, as Dr. Farida was mentioning, for the future, because we have to think that way. We have to think about prevention. An ounce of prevention is worth a pound of cure. And so many resources on the university campus have been allocated specifically to the pandemic from the different departments, from the hard sciences like the biology and chemistry lab to the social sciences, like studying human behavior and what's happening with, quarantine and studying economic policy and what's happening with, shutdowns and the like. So some examples of that include, from our biology and chemistry lab, they're working on a nanobody, which is an antibody from a South African llama, and its application on both COVID-19 diagnostics and therapeutics. The engineering department early in the stages worked on a reusable N95 mask that we could, help provide for mobile healthcare and to help with, number one, sustainability for the environment, but also when there was a PPE shortage, but also like in the social sciences and the government sector. So like I know some of the political scientists have set up a network called CoronaNet. It's one of the largest hand-coded databases for government policies to study, kind of what worked, what happened with the public, how do we do it later in the future. So it's been a gamut of things, and that continues. That hasn't slowed down. So a lot of the research is alongside the other research projects that are already going on has been dedicated to the pandemic for now and for future.
Thank you, Dr. Ayaz. Theodora, your degree was a BA in psychology, and little could you have predicted when you chose this specialty that it would be so crucial in dealing with public health, but also having a pandemic in the present time, let's say, and the impact that would have. So I want to ask you about how your decision to study psychology now, when you reflect upon it, given COVID-19, what your thoughts are, but also how you think the study of psychology might have been impacted by COVID-19.
Thank you so much for the question. And I couldn't have predicted in a million years that the degree I decided to pursue will be so important at times like this. And initially, when I started being interested in psychology, I was very curious just about both about individual behavior, where it comes from, but also I was very interested and was actively observing collective behavior. And I think now in times since the pandemic has started, having been exposed to a lot of psychology classes and just information, it really highlighted that aspect of mental health and the psychological effect of being in a pandemic and having everyone's life being shifted 180 degrees. And I think that also helped me understand how and why certain responses are there. It helped me understand why, for example, being or maybe this just came from my experience as student government president, but it just helped me understand the benefits of also receiving the necessary information and having communication and transparency, and how that and the psychological benefits coming from just having all the information you need to have to feel like you're making an informed decision. But beyond that, just being myself in quarantine after arrival at home, and having this drastic shift in lifestyle, I think it really made me understand how much, like Dr. Farida said, how much of the response should also be a mental health response, and how at the end of the day the mental health affects, like Dr. Farida said, the immunity and that the physical health to a great extent. So just to summarize, I do think that that the research of the study of psychology, or the field of psychology, has been really shifted after this.
I think that's a really good point, that psychology, even as a discipline in the modern era, has probably taken away many learnings about not only individual behavior, but collective behavior. And this brings me really to my final set of questions for you all, which is what learning you took away from the past year and a half, both in terms of your work or your field of study, but also about yourself. So it's really two sets of questions. One is about the wider learning, but also what you learned about yourself. So we know a little bit more about you before we come to the conclusion of this talk. So Dr. Ayaz, I would like to turn to you first.
Sure. Wow. What a profound question. I'm going to have to dig deep for this one. So I would say learning overall for society in general, I would say the pandemic has disrupted everybody's life on this planet. At the same time, it's shown what we can do when we come together. This is the first time, at least in my career, that every government in the world, hospital, research center, academic center was razor focused to find a solution, and we produced a vaccine in 9 months. And that is nothing short of a modern day miracle. We forget about how important vaccines are preventing polio and hepatitis and all these other things because we don't see it as often. They don't get the the credit that we often. They're like the famous co-star, but never the star of the show. So when we're not arguing with one another as world populations do, this is what we can do. So I'm very optimistic about that, and it would be incredible if we could do that again on other topics. What I learned about myself is, I would say, so I still practice in the emergency room in a critical access hospital. So when I'm resuscitating a trauma patient or a cardiac patient and running, pressors and these other things, you have to stay composed and you have to stay focused and you have to be knowledgeable of what the best evidence available is. And you have to act on all of that at the same time because it's chaotic. When the pandemic broke, but for a resuscitation in the ER, that lasts maybe a couple hours and then you're done. You can go back to just having some coffee or what have you. With the pandemic, it felt like that. For me personally, I was in that state for months at a time. And it was, I remember, we were waiting, calls in the middle of the night. People were scared and people didn't know what to do. And of course, we do the best as we can as we're learning things. But myself, I also was getting burned out. I was also, from a mental health standpoint, feeling, getting cynical, and said, you know what? I have to disconnect from this and start relying on other people, relying on my peers. Otherwise, I'm not going to function. So I think I learned that about myself, is that particularly in a crisis that lasts this long, we're all in this together, and you need everybody around you to do this right.
That's great. I love your positive sentiment about what we can do if we actually work together. And there are so many other crises, including, of course, the climate one. But if we could come together, and that personal reflection and I guess being kind to yourself is one that's really very important. Dr. Farida, I'd like to ask you the same question. The general learnings that the one key general learning that you feel that we've taken away from the pandemic, and I'm sure there are many, but one that you'd like to mention, but also a learning about yourself?
It's really a very hard question. I think the answer should be a whole book that should be written.
We'll wait to read your book. We'll wait to read your book, Dr. Farida.
I think one of the most important lessons that was about the collective response is the success that you could see. You could see that countries really varied in their response, and some countries really failed badly in handling the pandemic. I think the biggest difference was when it comes to the collaboration and the response support from different organizations within this country or within the system. So the success factor is really about the collective efforts. We have been in different organizations having different missions and visions and priorities. For example, for the academic institutions, their focus is students and their learning. But when it comes to the pandemic, we should break some of those barriers and work collectively towards the response. And countries who really focused on that and was able to harmonize the roles and responsibilities between different organizations, whether it's academic, scientific, health, and non-health institutions as well. The harmony of the response really that made the difference. It's not one person's efforts, not one organization's effort. It's really the collective work and how successful we are in the team work that really can make the difference. And I think this is a very important lesson that we need to reflect on and also share it with the future generations. From the personal level, I think there has been many learnings and developments that happening. The most important one is I have become more appreciative of my job and more passionate about what I do, because I have been always enjoying throughout my career helping others. But really, during the pandemic, how much you can give for others made the difference. So I'm really glad to have this job. And I'm also glad to work very closely with NYU University and the community as well. I really appreciate their efforts. And I also would like to thank them because NYU, one of the universities that played a model and a role model for other universities and their proactive engagement and proactive role in saving the community health and focusing on the safety of their community.
Thank you, Dr. Farida. Really profound insights, both on collective action, the job that you do that is important. And as I said at the beginning of this session, how much we all appreciated the work that you did and the comfort you gave us. But also great to hear about your relationship with NYUAD. I know they're greatly appreciated in Abu Dhabi. For the many things they contribute, be it research, be it the NYUAD Arts Center, and the brilliant students that are coming into the workforce. Theodora, I want to turn to you for your general learnings, what you think one key learning that's come out from this pandemic, but also what you've learned about yourself.
Thank you. I was just going through my search tab in my brain to identify all the points and isolate just one. But if there is one big picture learning point, and I've been thinking about this especially recently after coming back here and after reading about the response to the pandemic worldwide. And I started seeing this individual versus collective consciousness or awareness about the pandemic more holistically or more in a circular way. For example, some people worldwide would oftentimes say that not taking the vaccine or not listening to health professionals, that's their decision, and even if it may affect the collective, the nation collectively, it wouldn't affect them because it's for their safety. They wouldn't want to take the vaccine because they're not listening to professionals, etc., etc. And at the end of the day, I've learned that when individuals make those decisions or not make those decisions, whatever decision you make will affect the collective good. But that collective environment, and however it looks like, in the end, it will come back to you. So it's like a circular. The decisions you make affect the collective, the population, and then whatever happens in that big picture will come back to you. Because if less people, or if more people decide to not get vaccinated, that means more restrictions for a longer time, which means the pandemic will stay here for a longer time, which means that on individual level, we will all will have to go through this for a longer period. So I've just learned that I would say not complying or deciding not to listen to professionals, or just that disbelief in vaccination, that at the end of the day, it will affect the individual one way or the other, even if the individual thinks that that's not going to happen. So that's all to say that if there is an opportunity to get vaccinated, please do that, because at the end of the day, it will benefit the individual and the collective. So it's a win-win situation.
Theodore, those are great insights, especially your part about the things that we took for granted. But inshallah, God willing, much of it will come back with both the research that's being done and the scientists that are working hard on vaccines and the public health officials that are keeping us safe. But also, I think the efforts of everybody to take on responsibility. And I've greatly enjoyed hearing from all of you and learned so much, especially the point about collective action and our ability to work together to get through this and whatever future challenges may come about. And to see that NYUAD would have great students like you, Theodora, but also great faculty members like you, Dr. Ayaz, and then great partners like you, Dr. Farida, and to come together at these difficult times, but also to think of the path for the future and how we will forge that path ahead. So with that, we come to a conclusion. I want to thank you very much, our three great panelists, and also to thank NYUAD for the opportunity to moderate this conversation. And to all of you who are watching, thank you for your time. I wish NYUAD many happy returns and inshallah, many more years of great service to the community and great students graduating and doing great things in the world. Thank you so much. And happy birthday, NYUAD.
Thank you.
Thank you.
Thank you.